Hi everyone, today we're going to be doing our presentation on pancreatitis. We're going to be giving you some really good information as to how to treat it, what signs and symptoms to look for, and how it's diagnosed. Let's review a little bit as to where the pancreas is in our body. It's about 6 inches long, and the head and the neck extend into the duodenum. It's behind the stomach and lies just beneath the liver. The pancreas is an organ that is both an exocrine and an endocrine gland. Exocrine is for the secreting of the pancreatic enzymes into the small intestine. What does it function? It helps with the digestion of carbohydrates, proteins, and fats. Its endocrine function is to produce hormones like insulin and glucagon, which help with regulating the sugar in the blood. What is pancreatitis? Pancreatitis is an inflammation of the pancreas. And how does it occur? Well, remember those exocrine enzymes that get secreted into the small intestine? Well, during an injury or blockage to the pancreas, those enzymes get released prematurely and become activated. Now, normally those enzymes are not activated until they reach the small intestine, right? So if they're becoming activated while they're still in the pancreas, it actually causes the pancreas to auto-digest. Ouch! Talk about painful. Why? Because the pancreas is literally eating itself. Common causes of pancreatitis are usually due to a result of gallstones or an increased consumption of alcohol. Now together, these account for 70% of acute pancreatitis cases. Other causes will be mentioned during our presentation, which involves a case study of acute pancreatitis.
Hi, good morning. I know you're not feeling good, but we're going to go ahead and get you COVID tested. It's going to be a little uncomfortable. I'm going to have you go ahead and stick out your tongue for me. I'm going to swab the back of your throat, okay? I'm going to try to do it as fast as I can. Go ahead. Okay, all done. We're going to get this processed and we'll be right with you, okay? Hi, good morning. My name is Laura. I'm going to be your LVN this morning, okay? Can I get you to verify your name and date of birth for me, please?
Cynthia Lopez, March 12, 1991.
Okay, and Mrs. Lopez, I wanted to let you know that your COVID testing came back negative, okay? What brings you to the hospital today?
Severe abdominal pain right here.
Is it just in your abdomen?
Like goes all the way to my back.
And if you had to give it a score from 0 to 10, 10 being the worst pain, what would it be right now?
Like, I don't know, a 9.
And I'm so sorry that you're feeling this pain, but I want to let you know that we have a great healthcare team here. We're going to figure out what's going on, okay? Do you mind if I take your vitals?
No.
And I noticed that you're just lying in a side position. Are you able to lie flat on your back?
No, it makes the pain worse.
I'm going to go ahead and report this to your RN so that we can figure out what's going on, okay? And then here's your call light. If you need anything in the meantime, please let me know, okay?
Okay.
Hi, good morning, Boyana.
Good morning.
Your patient in room 13 is reporting a pain level of 9 out of 10 abdominal pain. Vitals are 99, temperature 95, 18, 135 over 85, and 97 on room air. She's saying that she has abdominal pain for about 3 days now, and she's not able to lie flat on her back. She's just in a fetal position.
Okay, thank you for gathering that information. Did we get her COVID results?
Oh, yes, we did. They came back negative.
Okay, great. Thank you. I'll go check on her right now.
All right, thank you.
Good morning. My name is Boyana. I'm going to be your RN today. Can you verify your name and your date of birth for me?
Cynthia Lopez, March 12, 1991.
I heard you're in a lot of pain today. Can you explain your pain?
It's here in my abdomen. It's been going on 3 days now. I thought it was heartburn and I took Tums and it hasn't helped at all. It feels like someone's punching me inside and it goes all the way to my back.
I'm so sorry you're feeling like that. Can you rate your pain from a scale of 0 to 10, 10 being the worst?
Like, I don't know, a 9.
Okay. Do you mind if I assess you? Okay, I'm gonna press down a little bit on your stomach and you're gonna tell me if something feels tender, okay?
That hurts.
Sorry. Okay, I'm gonna press on your pelvic area, okay? Is there any discomfort when I'm palpating right here?
No.
Are you having any difficulty urinating?
No.
Do you remember when your last bowel movement was?
It's been a few days.
Any nausea or vomiting?
Yeah, I'm really nauseous and like every time I eat, I throw up and I don't mean to. It just comes out.
When was the last time that you threw up?
This morning,
Were you able to see what the vomit looked like?
it's just a bunch of chewed up food.
And you're nauseous right now?
Yes.
Okay. When was your last alcoholic beverage?
I don't drink alcohol.
Any drugs or medication?
I take some meds at home, but I don't do drugs.
I'm gonna go ahead and get this information to the doctor so we can get you something for your nausea and your pain, okay? Just hang in there. Here's your call light.
Dr. Rodriguez.
Hi, Dr. Rodriguez. This is the RN Boyana. I'm calling about your patient Cynthia in bed 13. She came into the ER complaining of severe 9 out of 10 abdominal pain that is band-liked. The only thing that's relieving her pain is being in fetal position. The pain is not relieved by vomiting, which the patient reports every time she eats, she does vomit. Her last emesis was this morning, described as chunks of food. The patient is nauseated, denies pain when voiding. She does deny alcohol use and drug use. Her last vital signs were temperature of 99, heart rate 95, normal sinus rhythm, 18 respirations, blood pressure 135 over 85, satting at 97 on room air. Upon assessment, her lower lobes of the lungs were diminished. The patient has a history of diabetes and hypertension. Would you like to order something for the pain?
Yeah, go ahead and give her a one-time dose of 1 milligram Dilaudid IV. Let's also get her started on some fluids. You can go ahead and give her a bolus of 1,000 milliliters sodium chloride, 9%. And when she's done with that, just keep her on maintenance at 125 milliliters an hour. You can also go ahead and give her a Zofran 8 milligrams IV for her nausea. Let's get some labs ordered. Let's do a CBC with differential, lipase, and a CMP. Yeah, let's also prep the patient for a CT of the abdomen with contrast. Let's get an ultrasound of the liver done. And make sure you get the medication she's taking at home.
Thank you, doctor. I will get the medication list to you as soon as I can, and I'll go ahead and implement the orders and notify you when I receive the results.
All right, thank you. Bye-bye.
Okay, Cynthia, I talked to the doctor and we got some orders in place for you. The doctor ordered you to be NPO, so that means no food and no water for the time being. You will be able to have a few sips of water with your medication though. We did order some labs. They'll be coming in to take some blood, and as well as a scan of your abdomen. You'll have a CT scan, and they'll also do an ultrasound of your liver. We did get some medicine for you. Do you have any known allergies?
No.
Okay, so I have some Dilaudid here for your pain and some Zofran that's for your nausea. Can I just scan you? Okay, thank you very much.
So, am I gonna need surgery?
We don't know anything until we get your results back from the scans, okay?
Hi, Mrs. Lopez. How are you? I'm Dr. Rodriguez. How are you feeling today?
I've been better.
I'm sorry to hear that. I heard you were in some pain earlier. Did the pain medication help at all?
No.
Oh, if you could rate it right now, what would it be?
About an 8.
Okay, I'll talk to the RN and see if we can give you some different pain medication. I'm here today to discuss with you your diagnostic test. Is right now a good time for you?
Sure.
All right, let's see here. So your lipase was a little elevated. It was about 3 times the normal level, which indicates acute pancreatitis. However, your CT and your ultrasound can confirm that there's no gallstones or any blockage, so that's good. We want to suspect that it's due to your medication that you're taking at home, your hydrochlorothiazide for your hypertension.
So you're saying my high blood pressure medicine is causing all this pain?
That's what we want to suspect. We want to discontinue the medication for now, keep monitoring you, and hopefully the pain subsides.
So am I gonna need surgery?
No, surgery is only usually necessary when there's a blockage or any gallstones, but in your case, that's not the issue. We want to stop the body from creating any pancreatic enzymes, so that's why we want to keep you NPO, and then later transition you into a liquid diet when the time is right. We want to just manage your pain with some medication, your nausea, and keep you hydrated with some fluids. Do you have any more questions for me?
No.
All right, I hope you feel better.
Thank you.
So Dr. Rodriguez believes that the patient has pancreatitis that was caused by her hydrochlorothiazide. Because she's NPO, make sure to do frequent oral care, check her vital signs frequently, and be on alert for elevated temperature, hypotension, and tachycardia. Also be on alert for her respirations, and any respiratory changes, make sure you let me know right away. Also check her blood sugar and let me know if it's elevated.
Okay, and how often do you want me to do the vital signs?
3 times this shift.
Okay,
Thank you.
thank you.
Good morning. How are you feeling today?
Much better, thank you.
How's your pain?
It's good. I don't think I need pain medicine this morning.
Oh, that's good to hear. I just wanted to let you know about the new orders that we got today for you. We are going to advance your diet to a low-fat, controlled carbohydrate diet. Also, you'll be able to start solid foods again. We will monitor you after you start your solid foods just to make sure you're okay before you go home.
Oh, good, because I am in need of some dry shampoo or something.
I also wanted to go over some patient teaching with you in regarding your pancreatitis. As you know, yours was caused by your hydrochlorothiazide that you have stopped. You will need to discontinue it altogether once you leave the hospital. Also, it will be important for you to let your primary care physician know that you stopped it. So once you've stopped it, you shouldn't have a reoccurrence of the pancreatitis. Typically, pancreatitis is common with alcohol consumption, and in those cases, then we would tell those patients to stop alcohol use altogether.
Good thing I don't drink alcohol. But wait, what about an increase in Dr. Pepper consumption?
Oh, so far there's no evidence-based research that correlates Dr. Pepper to pancreatitis, so
That's good.
lucky there. But it is really important as being a diabetic that you watch your sugar, avoid sugary foods, and continue to monitor your blood sugar because high blood sugar can cause acute pancreatitis. It's really important to take it easy for the next couple of weeks, avoid strenuous exercise, and just take it easy until you get your strength back. I did bring some pamphlets for you. As we talked about, your low-fat diet's really going to be really important. And then also, as it says, you should avoid caffeine, spicy foods, and gassy foods because those can stimulate your pancreas and then exacerbate the symptoms again. I did put a dietary consult in for you, so a dietitian should be coming and talking with you to come up with a better nutrition plan for you.
Thank you so much. I'll try to watch what I eat.
Did you have any questions for me?
Not at this time.
Thank you. Hi Laura, so I know that you're going to be taking your NCLEX to become an RN soon. I wanted to ask you if you wanted to kind of go over our patient that had pancreatitis.
Sure, that'd be great.
So you remember Cynthia Lopez that was admitted for pancreatitis? I don't know if you remember when you were assessing her that you had reported some blue discoloration to her abdomen that was that surrounded her umbilicus.
Mm-hmm.
Do you know what that's called?
If I remember correctly, I believe it's called the colon sign.
Exactly. Also, when a patient's admitted with acute pancreatitis, what are some things that you might consider to be ordered for the patient?
I would think that the patient would be placed on an MPO status, and being that they're coming in with abdominal pain, I would think that they would also be placed like on some type of pain medication, maybe like hydromorphone.
That's right. Another really important thing that you didn't mention was deep breathing and coughing. It's really important to educate your patient and to monitor them every shift that they are actually deep breathing and coughing.
Okay.
Also, our patient that was admitted with acute pancreatitis, I know that you did assess her. Now understanding what pancreatitis looks like, what are some assessment findings that are consistent with pancreatitis?
I would think that definitely the left upper quadrant pain that the patient stated she had, and the discoloration around her umbilicus.
That's correct. Another specific thing about the left upper quadrant pain is that it's band-like and it radiates to the back.
Okay.
And also with as you remember with our patient, because of the pain, you will see them guarding their abdomen. That's also specific.
Right. She was. Okay. Thank you.
You're welcome. Okay. Are we rolling?
Code blue.
We're gonna give you.
That's going in the bloopers.
Endocrine.
Yes, I got that on video.
The pancreas is both an organ. Just kidding. It causes the pancreas to auto-digest. Pancreas.
Okay, I'm gonna listen to your belly, okay?
Now I'm going into respiratory distress.
I'm like,
Gallstones or blockage, and in your case that's not the issue. First an earthquake and now the lights are going out. It's a tornado. We should have just kept going. Don't mind the lights.
That's normal.
We're just too poor to fix them. Okay.
And did you look at the camera?
No.
Yeah, she did.
No.
She thought I didn't notice that.
What?
She captures it all.
doesn't look like you are. I can't take her serious in the pajamas. Wait, Laura, laugh for me. Laura, they don't know it's me.
Just stand behind there.
Wait, go. Ready, go.
I can't. Not on cue.
We'll just let her leave me like.
Stop it, girl.